First of all,
Okay.
welcome AidenYasuo. Thank you so much for hopping on my stream. Tell us a little
Thank
bit
you for
about
having me.
yourself. Yeah, and let's get some background and we'll get into it.
Yeah, I was NA's best Yasuo. I've been playing Yasuo. I'm 18 right now. I think the first time I played League was when I was 9 years old, so practically like 9 years of playing League. Um, yeah, this game's my life. Okay. So yeah, I hit shot at 15. And yeah, and first time I started dealing with my hand pain was like a year and a half ago, but I didn't really think much of it. And yeah, then it just got terrible, and now I quit the game. That's
Okay.
basically my summary.
Okay. Uh, so have you been playing PC games before League as well?
Um, I mean, not that I know of. I'm not the type of guy that like plays any other games. Only game I played was Minecraft. Like I'm
Got
that
you.
guy. Minecraft and League.
Got you.
That's it.
Okay. And then have you ever had any similar issues before?
Um, no, I've never really had any injury. Let's see.
Okay.
I'm
So no other
really
issues.
lucky.
So why don't we talk a little bit about like the background of the current issue you're having? First off, oh shoot, I realized it just popped. There we go. I realized that I label this a PT consult, but I'm not attempting to diagnose or treat any injuries during the session. I basically have to try to get some information on what might possibly be going on, and then give you some general advice on what might help. So, uh, in terms of what you're feeling, how long has it been since you started feeling this pain?
So I have to say, wait, we're like February. Okay. I think the first time it occurred. Yeah, I think that's it. The first time it occurred, I think it was like 2 years ago, honestly. But that was similar pain, but it went away kind of quickly. It just went away. That was like the
Okay.
first time it appeared though, but it wasn't nothing constant. It was just like I would play a lot, my hand would feel bad, and then I would have to stop.
Okay.
Um, and yeah, then it went away, and then I remember the first time like it reappeared. I think it went away for 6 months. That was just the first time. I didn't really think much of it though. It went away, and then I think one day was like season 13. It was season 13's yeah, first day of the season, and I was like competing. I was not competing, but I played a lot of games that day. Basically, I legit played I think 40 games that day
Oh, wow.
because I wanted to be rank one. I wanted the first one to be the challenger. Yeah, and then that's when it appeared
Okay.
again, and
So
it's
what?
every s-
Well,
yeah,
where is it? What are you? Where are you feeling it, and what does it feel like?
it's basically my whole hand, honestly. But I would have to say this finger, I don't know how you call it,
The pinky?
pinky and the thumb. It's not really affected. I would say it's more these three,
Gotcha.
and a side of here too. Honestly, it's kind of my whole hand, but
Okay.
I don't know why I'm caressing my hand like that. But
Yeah, yeah.
it's like
What does it feel like if you were to describe it? Is it like burning, stabbing, pulling, tingling?
just I have constant pain. Honestly, just
Just pain.
every
Okay.
all of
Like
the above. Yeah.
like achy or sharp?
Honestly, I can't really tell because it's not like the type of pain that just one day I live with it, the other day it's just been constant like in my hand for a year now. Even when I kept playing, it was
Hmm.
just constant. It's not the type of pain that I would play and at the end of my session it would hurt. Like it would hurt more at the end of my session. But even when I woke up, yeah, because I forgot to mention that first time this pain occurred, it was like I didn't think much of it because just like I would play, regular day. At the end of the
Hmm.
day, my hand would hurt. I would go to sleep, wake up, my hand was fine, right?
Yeah.
And then one day, I don't know, like it's like January, I guess, last year. It's like a year and some months. It just shifted. I went to sleep. I woke back up. I don't know what I did that day. I think I changed my sense. Forgot what happened. But yeah, I woke up and then pain was just constant. I was like, okay, it's gonna go
Hmm.
away, surely. I remember I took a 2 months. I took a 2 months. No, two-week break because the pain. I was like, what's happening? It's not normal because
Yeah.
it just became constant. I took a two-week break. I wore like a splint.
Hmm.
Just
Did
didn't
that
do
help?
much. Just
It didn't help at all.
no
Okay.
pain just kept persisting, and then I was like, okay, I guess that's not the option. I
Hmm.
went back to playing, and yeah, it was always bad. Like I would start the day. I don't think I've played more than like 6 hours, which is like still a lot, but like compared to what I used to do. because the pain would just get too bad.
Okay.
And recently, I could only play like 5 games. I remember the last game the last day I played, I lost the 5 games, and then my hand just I couldn't play, and then a 5 game loss streak. I can't keep playing. It's hard on like it's just pointless. So I couldn't play.
Yeah. So when was the last time you actually played?
League, the actual like session that I had a little over 2 months ago, but I think I played like a nerf. We went just trolling. I think I played on a nerf. That's it.
Okay. And then how did it feel during that?
Um, the it hurts harder, and then after that it hurts.
Hmm.
You know, but it's not like something. Um,
So even after a 2 month break, it's still hurting.
yeah. So now I'm like, okay, so break
Gotcha.
is not gonna do anything.
Yeah.
So
So generally, this is what I see is that the types of issues that I see most common in gamers are not really gonna resolve with a break because you've kind of gotten to the point where it's so flared up, it's constant. It's not just when you're playing. That means that it's more of a I guess it's more of a serious issue now actually. So have you had any neck pain at all or pain anywhere else?
recently, because I've been doing like, but I don't know if it's pain or just like I'm stretching. Because I was watching your vids with I think
With
the
Chase?
Valorant Pro you did.
Oh
Valorant
oh yeah yeah.
Pro
With
Chase.
yeah yeah.
No, I've been doing
With
stretches. I
Sways.
think
Yeah.
that you call it the thinker stretch.
Yeah,
Been
this
doing
one.
it, and I'm feeling something when I do that. You know, because oh yeah, I didn't tell you. Like I did X-ray on my hand. I did ultrasounds.
Hmm.
Like, and they didn't detect anything.
Yeah,
So
that's
my
not
like
surprising. So X-ray is only going to detect anything if there's some sort of fracture or malalignment of the bone. Ultrasound sometimes can be helpful, but usually not for this type of thing. If there was a tear or some kind, even an MRI probably isn't going to show very much. It might show a little bit of inflammation, but what I think is going on is probably more either a tendinopathy or a nerve pain. So none of that stuff is really going to show up on imaging. It's mostly going to be either a nerve conduction study or a clinical diagnosis, which is sort of like going and getting a full evaluation from a PT, or it's probably going to be a PT or an OT, and then they would kind of come up with that based on your symptoms. But I can sort of maybe determine whether or not at least we think it's nerve related or more muscular related, and that will give you an idea of where to start. So, have you had any numbness or tingling or weakness in the hand?
I think I've had everything. Like
Oh,
all of
okay.
the
A lot of symptoms.
it's just yeah.
Does it hurt to not to use your mouse, but to just hold things? Like if you're gripping a cup or
Yeah,
if you're.
yeah. Like let's say right now it's a little less present. It's still present because obviously it's constant. But
Mhm.
if I'm trying to like flex the fingers, it hurts a little bit more.
Okay.
And yeah.
Is
And
it
so
is
yeah,
it
when I
mostly
I
just on
guess
the
when I
palm of the hand, or does it hurt on the back as well?
it's the back as well and the palm too. Like I would say the palm, the 3 fingers, here going in the 3 fingers. I would say the thumb here is not really affected as much. Recently, because I still use my mouse. I just swapped like, there's like buttons on the
Hmm.
side of the mouse. I'm just using my thumb to click now because like I just can't use it easily. It's terrible.
Okay. Um, are you exercising at all?
Um, no, if I was exercising before, but ever since my hand like started, I was like yeah, whatever I have, I don't want to hurt it more. So
Yeah, yeah.
only thing I've been doing is like push-ups. I don't know if that's bad, but just
Does it hurt when you do push-ups?
not necessarily. It
Okay.
kind of stretches, the
Okay. Yeah, yeah. So that's actually a good sign. So what we're trying to do is establish a pattern, right? Determining what positions, what movements hurt and don't hurt. Both of those actually give very good information. So why don't we look at a couple clinical tests here? So I'm going to look at your range of motion first, just generally. If you sit straight, turn your head left and right as far as you can, and then tell me, do you feel anything with either of those two directions?
uh not necessarily, no.
Okay. Nothing down into the hand, nothing into the neck. No, it's all good.
No.
All
Yeah.
right. What about looking up and down?
The max I can, yeah.
Hmm.
Like my
Any pain there?
like in the neck or in the hand.
Both.
No, nothing significant. I wouldn't say.
Okay. All right. Let's take a look at the hand. So if you go like this, or I guess it'd be this one, you're going to bring it down. Do you feel any pain there? What do you feel?
Uh, it kind of. Wait, let me compare. Yeah, it kind of stretches. Feel like there's like a nod or something.
Okay.
Because
What about this way?
I'm gonna do this hand too just to compare.
Yeah, yeah,
Like,
yeah. I think that's good. Mine's actually very limited. I'm tight. You have good range,
uh,
actually. How does that feel?
I have good range, but here it is like there's a lot more stretch. Here I don't feel anything, let's say, and here it's a lot more.
Okay. Um,
Like I've
what about if
and
you
it
go?
also when I'm maintaining this position, it kind of sends like signals to my fingers. They're like
Yeah, okay. Does
trying to.
does the pain ever go past your wrist into your arm at all, or is it only in the hand?
Recently I've been kind of feeling something like here,
Okay.
but I don't know if it's like because I'm trying to believe, but something, but it's not
Okay.
significant. It's more my hand, but I'm feeling something like here, like on something.
Okay. Try excuse me. If you watch my other videos, you might have seen an exercise like this, right? The median nerve glide. So when you
Yeah.
do
Can I?
this,
I'm gonna stand up doing it.
yeah, yeah. When you do this, what do you feel?
Um, Nothing significant. It stretches, I guess.
So not palm down, like put your palm away.
Yeah.
Yeah, yeah, like that. Do you feel anything there?
I guess. Yeah. Yeah. I kind of have difficulty like keeping it in that position.
Okay.
Like my fingers are they're like like boom.
Yeah, tingly, like
Yeah.
buzzy.
Yeah.
Yeah. Is that similar to where you feel your pain?
Yeah. I guess. Yeah. The whole hand. I feel something.
Okay. And then what about if you do this? If you kind of grab your thumb, bring your hand down like this. Yep. And then reach behind you. Anything there?
I'm gonna compare because I've never done that before. Honestly.
Yeah. See if it feels the same or different, side to side.
Hmm. That definitely hurts a little more,
Okay.
honestly.
Okay.
But nothing significant, I would say. It's a good stretch.
Put your pinky behind your headset. Anything there?
I guess, yeah, it kind of hurts here.
In the thumb or in
In
the
the
back of
back
the
of the
wrist?
thumb, I would say. Yeah, back of the wrist.
Okay. Okay. Let's do this one again. I say you feel it here, right?
Yeah.
Bring your head to the other shoulder. How does that feel?
And my fingers are like they're trying to, come back.
They're curling up.
Yeah.
Yeah. Okay. So you
And
might
oh,
have
it's
said,
I can feel something like going
ah,
here and now.
okay. Okay. So that's what I'm looking for. So what you're doing right now is actually called a median nerve tensioner. The median nerve is one of the three major peripheral nerves that goes into your arm. The median nerve runs into these three fingers through the palm of the hand, and doesn't affect these two too much at all. So it kind of fits your pattern. When you did that, and you bring your head over, you're fully tensioning that nerve along your arm, and then you're also tensioning at the root of the nerve at the neck, which is oftentimes you're going to feel that through here, through the arm. The pathway is it runs through the neck, through your chest, into the armpit, down your arm, front of the hand, palm, into the
Yeah,
fingers.
honestly, yeah, I've been
Yeah.
feeling something like here, so that
So
makes sense.
it definitely feels like, or it seems like you have some median nerve irritation. Um, it's really common, especially in the mouse hand, that you have some compression there. So what we want to look at is, okay, this is something that should have gotten better if you're not using it to play very much, but it might still be getting irritated based on other stuff you're doing. So if you're still using your mouse to do everyday stuff, and your ergonomics are off, or you're doing something that's stressing that nerve, it's not really going to get better. It's really
Uh,
common because that nerve is also really involved with gripping and grabbing things. Um, Actually, when you do push-ups, it might actually feel kind of good because it's like a light stretch of it, and you're
yeah,
actually working muscles that are kind of proximal or closer to your neck, so you actually get better blood flow. That actually might feel better.
yeah. I've,
Uh,
I've I've noticed doing push-ups actually
yeah,
helps, honestly.
yeah. So it makes sense. It's a good thing.
Yeah.
Um, So if you haven't had any weakness, burning, or numbness, I actually don't think it's that serious. I think what it is that you're not really sure of how to avoid irritating it. And so when you do stuff like play League, it's just flaring up and there's not much you can do about it. So what we have to do is we have to establish, okay, well, where is your limitation right now? If playing 5 games is going to set you off for 2 months, we can't play 5 games. We have to try playing 1 game. And oftentimes, when I have players who have this kind of stuff, try to get them back into playing, I don't advise them to play Summoner's Rift yet. Like, I'd probably first start by thinking of each mini session as a block of time. I'd try to play an ARAM first. Or I would, if it's really bad, you regress all the way. Go in practice tool, and all you're going to do is like farm. And you do that for like 5-10 minutes, see how it feels. Because at the end of the day, mechanically, it doesn't matter if you're playing, an actual ranked game or playing an ARAM or playing just in practice tool. The mechanics of what you're doing are very similar for the mouse, right? So you want to think of that as just how much time are you testing it for? If you play 5 games in a row, I mean, that's not just five hours. Well, it's probably a little more than that because of your queue timer and all that. And then in queue, most of the time, people are actually doing other stuff. So it's almost like you never fully get a break. It's interesting that you've already completely deloaded this. So at this point, I don't think rest is actually going to help. I think what we have to do is figure out how to stop irritating it, and then also how to relieve these symptoms, how to develop more nerve mobility. Watching the videos, did you try some of these nerve glides that I gave,
Yeah,
like Chase and all them?
yeah, I did. I don't know how like frequent I should do them because I've been doing like a couple every day. But the videos that I watched, I think I've been doing this for like 4 days, I think only. And honestly,
Okay,
I've been feeling improvement already because
good.
honestly, if if
Yeah,
um if a break's not gonna do anything, I need to like try to actually take action.
exactly. No,
Someone
and
told me,
that's really good because what's actually going to help this, and I kind of mentioned blood flow, is increasing blood flow to the nerve. So the more you do that isn't pissing it off or irritating it, the better it's going to go. Now, if you do everything right, the way that it is in terms of intensity, I actually think that it'll feel a lot better within the next 2 to 4 weeks. And
honestly, yeah,
yeah,
I think so too. I'll be
good,
honest.
good. So what we want to do is give you a step-by-step kind of like plan of, okay, we'll start with these things, do these things, and then this is what you should expect after a few weeks. Number one, though, like I said, the first thing we have to do before we try to resolve any of the issues that you're having is we got to stop pissing it off. We got to stop making it worse. So the number one predictor for me in terms of how it's getting worse is probably your ergonomics. So I want to see your setup if we can, like, just your
You honest,
well, like yeah, if you can angle your camera down, and I want to see what it looks like when you're holding your mouse in
because
relation.
I'm on my brother's setup, so
Oh, okay, okay. So this is not your normal setup, but
no, but it's similar. Honestly,
okay. We can still take some of the concepts that I'm going to talk about, and then you can apply them yourself to your actual setup. But yeah, if you could angle the camera down, I just
oh,
want to see your hand, wrist, all that alignment on your mouse.
how do I do it? This
Maybe
camera.
hold it with your left hand. Yeah, and then yep.
Honestly, just
Okay, that's not bad. Okay, perfect. Right there. Um, do you think the desk height is similar to what you normally play on?
yeah, that's the same. That's we have the same desk.
Gotcha. Okay. So is the camera detachable?
No, it's just with a. Yeah, I can't detach it.
Okay, that's fine. You're gonna help me and self-assess this yourself then. So is your elbow hanging below or is it above the edge of the desk?
I always keep it like parallel, like this.
Parallel. Okay, okay. Is it supported? Do you have an elbow rest on your chair?
Yeah, yeah, right there. I don't know if you
Perfect.
see it.
Yeah. I just can't tell if it's actually sitting on it. Okay.
Yeah,
And
yeah.
then is your wrist, if this is your desk, imagine the phone is your desk, is your wrist sitting slightly angled upward like this? Like a 15 to
Yeah,
20 degree.
yeah, yeah.
Okay, perfect. All right. And the alignment overall looks pretty good. So what I didn't see was a whole lot of like this type of stuff or like
I
deviating.
want to say something. I used to play like this.
Yeah. Okay.
And I noticed it and I immediately like corrected it.
Okay.
And I bought a new mouse. I bought a new mouse and I fixed it.
Okay.
But
Now,
maybe that.
yeah, that's definitely one factor that can definitely increase pressure at the carpal tunnel as well, which can lead to some of this stuff. People oftentimes talk about carpal tunnel syndrome. as being bad for gamers. I actually very rarely see true carpal tunnel syndrome. However, carpal tunnel syndrome is affecting the median nerve. So in your case, the median nerve is the nerve we're talking about. It could be potentially a cause or a contribution to it, but I don't think it's coming from your carpal tunnel. I think it's definitely coming from elsewhere, and maybe you're feeling the same symptoms in that nerve distribution. So I don't want to worry you and say, oh, you have carpal tunnel syndrome, but you probably do have irritation of a nerve that's related to that.
Yeah,
So
I think I saw a doctor and he told me like he made me do like a couple of exercises and he
yeah,
was like, yeah, if you had carpal tunnel, you wouldn't be able to do that, and I get it
Uh,
pretty easily.
I think it
But
depends because carpal tunnel is
uh,
it's a spectrum. Like carpal tunnel syndrome is okay. You have so much nerve pain that it's constant. You're like you basically constantly feel buzzing, tingling, fiery, burning. Can't grip anything. That's true carpal tunnel syndrome. You can still have irritation of the median nerve just at a 2 out of 10 instead of an 8 out of 10, right? So it's just a how irritated is it. Um, so I do think that your symptoms look a lot like median nerve irritation, though. I'm just not trying to demonize it by saying carpal tunnel syndrome because that's a specific issue that's related to this. If you hold your mouse up, I want to see what it looks like in the footprint, what I call the mouse print in your hand.
boom.
Oh, okay. Okay, so yeah, you got the thumb rest and everything. Awesome. And then turn it for me like this. Okay. So right now you're using these thumb buttons to click, right?
Yeah,
Um, are you using the thumb buttons to, have you tried playing like that, or it's just because you're using your mouse for daily stuff?
yeah. I'm not really playing,
Okay.
and honestly,
Okay.
I wouldn't. It's kind of hard,
Yeah,
I think.
I'd recommend switching back to a normal click, like the normal mouse click buttons, so that you can actually test this as we go
Yeah.
forward. If it's really bad, you can always go back to the thumb buttons for daily use. But obviously, if you're trying to test it, try to use the actual buttons.
All right.
Okay.
Yeah.
Okay, so let's talk about what to do now. So the way I think of nerve irritation, it's usually you got to think source to where you feel it. Your issue's not in your hand, right?
Yeah.
Does that make sense? Like your issue's actually up higher. We need to determine how high up. So in the example of carpal tunnel, that would be here. If you had pronator syndrome, that'd be like over here somewhere. If you had TOS or thoracic outlet syndrome, that's over here somewhere. If it's cervical radiculopathy, that's actually in your neck. So we can kind of trace those. Those are all just really fancy medical ways of describing the same thing. It's nerve irritation. They're just describing specifically where the irritation starts from and where we need to treat. I usually think top down. If we do these neck stretches and we start doing stuff around the neck and you feel irritation into your hand, this might be a contributor. So we probably want to start there and then work our way down, right? So usually the first thing I would do is that scalene stretch or the thinker stretch that you already talked about.
Right.
You're,
I'm gonna put the cam back.
yeah. Okay. And that's, yeah, you're going to tilt your head and then you're going to turn and try to look towards the ceiling towards the right. Yep. Do you feel that stretch across the front side of your neck?
Yeah, I do.
Okay. And then do you feel anything into your hand or into your arm?
Yeah, I would say I feel something here, like the area I told you
Okay,
about.
great. So there might be some net contribution there. All right, so that's the first stretch. You're gonna start top, move our way down. So you're gonna stretch
Wait.
that.
Is it this the I do the neck? Do I put it towards my hands or the
So
other
you want to
side?
feel the stretch on the side closer to that arm.
Okay, yeah.
So I usually, however, everyone's a little different. I find it you kind of have to play with the range. So I find it I feel the stretch the most when I do it like this.
Okay.
Yeah. So I think I almost think about like pulling my chin away from my collarbone or something like that. You know, you the muscles run diagonally from behind your ear, kind of down towards the front of your neck. So when you stretch it, you want to try to open that space as long as possible. That's how you're going to get the most stretch out of it. All right. So you
Yeah, that
start with
makes
that. Do
sense.
it lightly too. The thing is, the scalene muscles are vertical, and then the nerves kind of run through them. So when you tension something vertically, it also does this, right? So it can actually pinch down on the nerves too. So make sure
Okay.
you're stretching very, very lightly. And then I like to follow that sometimes with some deep breathing where you do inhale, and then as you exhale, we were trying to bring the ribs down. That actually also causes a stretch. The scalene muscles connect to the first rib. So as you depress the ribs, you can actually get a little bit of a more active stretch of those muscles as well. It also calms down your central nervous system, which a lot of times when you have sensitized nerves, it actually can reduce some of the perceived pain you're having too.
Oh,
Oh man, Kumi. All right. And then okay, after that, so we're gonna go. So if we went from the neck down to the chest, pec stretch, you can do it two ways. You can do it this way, where you pull your shoulder blades back, and you should feel that stretch across here. You can also just open your hands wide and feel the stretch across the front of the chest. Do you feel a stretch there?
yeah.
Yeah, good. Hold that for 15, 20 seconds. Good. Awesome. And then I like to follow that up with the nerve glides. So now that we've kind of freed up the two proximal entrapment points, you're going to do this nerve glide that you were doing, right? This one, palm away, fingers down, and then fingers towards you, palm towards you. And you're going to do 15 to 20 of those. And ideally, you want to do this so that you start to feel some symptoms, but it doesn't get like too severe. You want to be right at the edge of range
Okay.
that you
Well,
start
I'm
feeling.
feeling
You feel a little bit or a lot.
okay. And yeah, kind of a lot, honestly. As soon as I did a couple.
Yeah. So be really conscious about this because if it's flared up, you're having a bad day, you're not going to have the same range as when you're having a good day. And what you don't want to do is think, oh, every day I need to go all the way to here. Because if it's really tensioned and it's really irritated that day, you go to here, you're going to just really flare it up. So
Okay.
you want to think, okay, some days it's going to be better, some days it's going to be worse. I'm always going to try to pay attention to what I feel, right? If I feel symptoms here, that's where I stop. I come right back. And then over time, you slowly push into that range, right? Your whole goal here is to remind your body of how much range and length it has in those nerves without overly stretching them and causing irritation. So it's a really, really tricky thing. You'll have to fine tune yourself and just be really conscious of what you're feeling. And then after that, I'm going to do tendon glides. So open and close. And I like to add some wrist movement to that. Yeah. Just really gentle. Again, you're just trying to move everything through range. So this is really, really useful for people who also actually have carpal tunnel syndrome. The tendons of your fingers run through the carpal tunnel through to your forearm. They basically are the carpal tunnel is basically a channel. It's like a box. And then all the nerves and arteries and tendons run through that. So if there's inflammation there and things aren't moving very well, that affects the nerve. The nerve's not moving very well. That causes a lot of irritation. So if we can get the tendons to move better, a lot of times that also frees up mobility of the nerves. So you do a couple of these.
When I do this, I notice I feel like something here.
Yeah,
There's like a knot.
this is considered the most compression of the carpal tunnel. So
Okay.
this position specifically increases the amount of stress on that nerve more than anything else. So yeah, going down, just be really careful not to go to a point where you feel pain. You might feel pressure, you might feel a little bit of your symptoms, but it should not be painful. So just really light, okay? And then the other one I want you to do is you're going to go open and close this way. This is something newer I started telling people to do based on some research that I read and Con Ed course I went to, or I did online actually. But this has actually been shown in cadaver studies, meaning when they dissect a dead body and they pull on things and they see what moves the most. This actually had the most excursion of the nerve. So when you do open and close, you actually get the most movement of that nerve through the carpal tunnel, through the arm. Right. Good. And then just wrap it all up, kind of shake it out. A lot of times people will kind of do this habitually, like if they have these kinds of symptoms, right? So they'll be playing, and after they play, they have to like shake it out because it feels better. That's a very textbook sign of carpal tunnel syndrome or median nerve irritation. So to reiterate, start at the neck, go to the chest, stretch those, do the nerve glides, and then do tendon glides. Okay. You're going to do that every day, at least 2 or 3 times a day. And
Okay. So yeah.
yeah,
When I wake up, I
yep,
go to sleep.
yep. This is going to, if it goes well and it doesn't irritate things, I have to caveat that because there is a possibility that when you do all this stuff, it actually flares it up a little bit. If it doesn't do that, you should feel a lot better in 2 to 3 weeks. If it does do that, we just back off a little bit from the nerve glides. All right. That's the only one I would back off on. All the other stuff I would continue to do, but make sure you're listening to how your body responds to it. If it's really, really bad, if your symptoms feel like they're getting worse, what you can also do is maybe try an ice pack for about 10 minutes at the neck or at,
Okay.
like up here, and then try it again. Right.
Sure.
In some cases, I don't think you're one of these people, but if the nerve irritation is really, really bad, you're actually going to feel constant symptoms. That's what we want to try to avoid. I think you're right at the border of that, because if you're starting to have pain with just not doing anything that's normally provocative, that's something we have to avoid. We have to try to prevent you from getting into that space, because then that becomes a full blown medical thing. You'll probably have to go to inpatient physical therapy. Then the rehab
Like,
process is like 3 to 4 months. So
do you consider that I have that? Like, if my pain has been like legit going on for a year and it's
Uh,
constant.
yes and no, because I don't think it's constant in that it's progressively worsening with stuff you're doing. I just don't think you're aware of the stuff you're doing that's annoying it,
Okay.
if that makes sense. And so a lot of the stuff you're doing, I actually expect to annoy it. So even though you're not playing, if you're using your mouse every day, it's sort of the same thing actually to your
Yeah.
body. It's just not as intense. So I think there's a lot of factors there that might actually contribute to that. If you've said that you've already started feeling better after a few days of just doing some light stretches, then that makes me think, okay, this is actually going to do really well. Now,
Okay.
I call this like phase one, where we're starting to just improve mobility, improve the ability for your body to move through this range. Phase two, after this stuff calms down, so after 2 to 3 weeks of this, then if things calm down a lot, then you start strengthening. And when I say strengthening, you're going to be working muscles that help contribute to taking pressure off of these nerves. So I would do a lot of stuff like shin tucks. I would do a lot of like band rows, like pulling back your shoulder blades, doing more pulling strengthening, like rows and deadlifts, that kind of stuff, pull downs,
Yeah.
because that pulls your shoulder blades away from the front. That takes pressure off of the nerve roots here. Does that make
Okay.
that's the only reason posture really matters for this stuff. Like good posture just means you have less stress on your nerves
Okay.
in reality, and you're less
Okay.
likely to injure other stuff. So um, we can talk about
I've
phase
been
two separately if you want at some other time. But yeah,
okay. Sure. I've been doing this one too. Like, I see you to talk about like putting the thumb here and like stretching.
yeah. So careful with static stretching, meaning that if you're doing these stretches a lot, yeah, they're good to do for flexor muscles. Stretches are more for muscles. So
Okay.
if you have nerve pain and you stretch, you're also stretching the nerve. So if, like I said, this one especially, if you're pulling down and this is creating the most compression possible on that nerve, yeah, you're stretching these muscles and it feels good, but you're also now compressing that nerve. So that might actually lead to more symptoms. This is the problem that a lot of people have when they don't know what's going on with their hand. I see this a lot in players. They think that because their hand or wrist is hurting, it must be I don't stretch enough. They just they constantly stretch really aggressively, and it turns out they have a nerve issue. What they're doing is actually flaring their nerve up over and over and over. And so I would hold off on a lot of the more aggressive stretching for now. I would focus more on the mobility.
Okay. Sure.
Yeah.
Um.
And that's something, again, I just feel bad. That's why I try to put a lot of content out about that. Not a lot of people understand that the vast majority of these issues are actually more nerve related and more activity related than they are hypomobility or tightness. Most people aren't tight that I work with. Like most gamers are not tight through all these muscles until except for right after they play. Like on in general, like they're actually hypermobile usually. They're just way too loose. They don't have good control, they don't have good endurance. So yeah, I would focus a lot more on the mobility work, and then from there you go into strengthening after a few weeks.
Okay.
Okay.
That sounds
Uh,
like a good plan. Yeah.
yeah. The other thing is make sure that your elbow rests are high enough that your shoulder level is neutral, right? So if I'm down here, right, so you can see the difference from this shoulder to this shoulder now.
Yeah.
If I'm playing like this, I'm actually also creating tension the entire time on my nerves right here, right? So I want to make sure that the elbow rest is high enough that I feel like my shoulder is at a neutral rested level, not too low, not too high. Because when it's high, what happens is, as especially when you play competitive games, league players, we tend to hold a lot of stress in our neck, right? Or people in general hold stress in our neck. League is inherently a stressful game. And so when you stress and you're already hunched up like this because your elbow rests are holding your up, it's just going to cause more and more tension here. And that's going to shorten the scalene muscles that I talked about.
I
And
think I
that's,
used to play like this.
yeah, I see people all the time. I see people all the time like that. So when they play like that, like this, these muscles get really short, and then when they get out of that position, now these muscles are tight and they're pinching down on the nerves. Right. So, yeah, think about elbow rest height. The rest of your ergonomics actually looks pretty good. Another trick I tell people about the monitor so that they don't do this as much is make sure that your monitor is angled up slightly.
Okay.
So it shouldn't be vertical, right? If you have a vertical monitor, what your head tries to do as human beings, whenever we see a flat surface, we try to align our vision 90 degrees with it. We always want to look at it perpendicular. So if your screen is straight, you're going to end up doing this in order to get 90 degrees with the flat panel. So if you angle your monitor up, you're actually more incentivized to look slightly downward. That actually keeps your neck straight.
Okay. Yeah, that sounds. Yeah,
Oh,
honestly, that makes sense. Yeah, I got it. Yeah, I think my monitor's flat, honestly, if I'm being
it's
honest,
flat.
or slightly up,
Yeah.
but like
So
nothing.
a good rule is like you take your eye level, that should meet the top of the screen, and then you angle the bottom forward a little bit so that it's sort of like this slightly, like if I was to look from the side, it would be this slightly angled down. This is like ideal. Because now,
Okay.
most people tend to lean forward when they play. If you're leaning forward when you play, but you're angled downward, your neck is actually straight relatively, right? If it's not, then you're
Okay.
doing this. So yeah, that's another one to consider. I don't want to get. I mean, we could talk about the chair stuff. Something I always tell people is if you're a forward leaner when you play, just don't use the back of your chair because then you end up playing like this.
Yeah,
Just
no, I'm never.
yeah.
I'm never in the back of my chair. I'm just like
Same.
kind of just.
If you want, like when I play like this. I don't even touch the back of my
Yeah,
chair. I'm always like,
same.
yeah. And then in between games though, when you're waiting to queue again or whatever, that's when you can actually scoot back and relax because then you're resting. When you sit forward like that, it takes a lot of energy. It takes a lot of core strength. It takes a lot of endurance. So usually I don't do it the whole time I play. I do it every single game, but then in between games, I just kick back. I actually scoot back and relax to give yourself that break, and then that way the next game you can do it again. Um, yeah, I don't think ergonomics is a huge factor. It's something to consider in your case, but I think in your case, what's going to help the most is just mostly just doing more activity with your hand and wrist. I would just throughout the day just regularly like do circles, do like what I call the jellyfish. It's like this is a really good just general nerve glide. I do these all the time. I'll do these, and I do like the jellyfish. It just keeps everything feeling loose and warmed up. Uh, Wait, before you play, now we got to talk about habit formation. Before you play, I want you doing these guys, right, as a warm up. You got to get blood flow into your wrists and hands, right? So you do these, you do all the stuff we talked about. You do that every single time, and then you try to play. And when you first start
Okay.
trying to play again, like I said, you're gonna do a progression upward. So you're gonna start with probably just going in practice tool and just clicking around. Maybe try to farm the first 6 waves, right? Because if you can't farm the first 6 waves, you for sure can't play the game.
Yeah.
Like but if you can farm the first 6 waves, okay, great. That takes about what, like 5 to 10 minutes basically in the practice. You could probably speed it up, whatever you want to do, but spend about 5 or 10 minutes. Sorry, my dog sometimes just gets upset that people live outside. Uh, you spend 5 or 10 minutes in practice, and then you assess. You stop, assess. How do I feel? Go through some movement. Everything feels good. Great. The next step is play an ARAM, right? And I'm not talking like in the same day. You can try this, give it a whole day, see how it feels. Next day, now if everything felt great, let's try an ARAM. You play one ARAM, see how it feels. The next day, then you could try playing the full Summoner's Rift game. Everything goes well. Or you do one ARAM, take a short break, play another ARAM. However you want to structure it, you just have to have a steady plan. And the most important thing is do not give in to that voice in the back of your head that says, "Hey, I think things are feeling pretty good. You should grind 9 ranked games now." Like that's something I've seen a lot of people do, and it always feels bad because you just spent all this time and work getting to a certain point, and you throw it under the bus because you decide you just want to grind. And this is especially dangerous for high elo players because you don't
Yeah.
know how to play the game without grinding. Like the fact that you played 40 games, I don't even know how that's possible. Like
Yeah. I
physically
never did it
possible.
again after that. I was stuck on.
I don't like physically. I don't know how a human can do that because it's so mentally and physically draining to play League, right? I think the longest I ever did was I did 11 hours at a subathon once, and I was dead. And I'm in good shape. I know all the stuff. I was stretching in between. I was doing everything. I just couldn't keep doing it. You know, like my shoulders are super sore. My hand was aching. Like all this stuff adds up. So you just got to think about it in breaks like that. And then once you get back, hopefully soon, once you get back to playing 100%, you know, like in terms of, oh, you can do whatever you want. You could theoretically play 10 games in a row if you wanted to. You just never ever do that again, though. You break it into micro sessions. So if you're going to play 10 games in a day, what you're actually going to do is play 2 games. You're going to take a break, and you're going to play 1 or 2 games. You're going to take a break. You're going to play 1 or 2 games. You can break it up that way, right? I think most league players could easily play 2 or 3 games in a row with no issue. Very few could play 12 games in a row. However, almost every player could play 2 to 3 games in a row 4 times a day, right? If they took an hour off in between each one, like you almost feel 100% by the next set. It's like it's not that much time. You're basically playing for an hour and a half, take an hour off, play for an hour and a half. Like that's actually very little workload overall, right? So that's how I would think about getting back into a practice routine. The first thing is you need to address the physical stuff, right? The stuff that exists outside of the game. The next step is you start incorporating that into the in-game stuff. And you need to structure it as time. So practice tool is the least amount of time. ARAM is about 20 to 30 minutes. Then actual game is like 30 to 40 minutes.
Okay. Yeah.
Okay.
Well, I wanted to say something. I just got lost, but yeah, that makes sense because I don't know why, but yeah, I would say the first like when it appeared again, that pain, that kind of went away, you know, because I
Mm-hmm.
played less.
Mm-hmm.
That day, I just forgot about everything, just full grinded.
That's
I wanted.
that was your body asking for help, and you threw it right back down. Like it was begging you for water, and you said no. You're like you basically just
I think at one point it's not even your hand playing. It's your head. It's just you're
exactly,
just.
exactly. But you got to think too. While you're playing, how many times did you probably realize it was hurting, and you get into a team fight and you just push it out of your mind, and you
Yeah.
just do what you need to do. You know, it's the same thing as like athletes, right? And this is the parallel between esports players or gamers and elite level athletes. You think when a football player twists their ankle, but they're in a championship, they're gonna not play? No, they're just gonna run through it, and they're gonna suffer the consequences after. Now, that's a more extreme example of what you were doing on a smaller level, but every single day for months. Like,
Yeah, I want to say for a year, honestly,
yeah. So that, I mean, if you think
because
about
I kept.
any elite football player doing that to their ankle for a year, they're not going to be running the next year. You know,
Because
like,
I kept like stretching the time. I remember I switched everything. I swapped the mouse, that helped
yep,
for a bit. I switched sensitivity, that helped for a bit. I think I used to like only play with this finger, then I incorporated this finger
yep,
like a click. I don't know
yep.
if you know about it.
hmm
I just changed everything, then it again, then I could only play 8 hours, now I had to 7 hours, 6 hours, and
So,
then
so
it just
what
got
you
worse.
were doing, what we call a compensate. You were compensating. The problem with compensating is it hides the issue. It doesn't address the issue. That's like, okay, if your right ankle hurts, you can compensate by putting more weight on your left leg while you walk. But if you just keep walking on it, it's not really going to get better. You know, like you
Yeah.
kind of have to treat the issue. So, a lot of what I'm teaching you and a lot of stuff I work on with players is not anything magic or anything. Your body is trying to heal. We have to learn how to get out of the way and let it just do its job. It's every day trying to get there. All right. So yeah, let's try that stuff out. I actually really expect that within 2 to 3 weeks, you're going to feel significantly better. That's when you start incorporating the return to play, which is structuring out your actual practice schedule around timing. Okay. And
So
then, yeah,
you recommend just playing an RM, go for a walk, come back, see how I feel,
it doesn't even have to
just look
go for
for
a
it.
walk. It could be like, okay, let's say that you can play an ARAM with zero pain. After that, what I want you to do is just do some of the wrist circles, do some of the tendon glides, do some light stretch, do maybe some neck stretch, just move around a little bit in your chair. Maybe that takes 5 minutes. And then you
Do
play
some
another one.
push-ups.
Yeah, if you want. Yeah, do something, right? Get some blood flow. And then play another one. This is always going like nerve pain is almost always related to blood flow issues, unless you have some sort of diagnosis that, like some sort of a disease or an autoimmune disorder, something like that. most mechanical nerve pain is a direct relation to loss of blood flow. So if you think about it, how do you increase blood flow to the nerve? There's a bunch of ways. You could do exercise involving the trunk. You could do squats even. Just getting your overall blood flow to increase might actually help. What you don't want to do is some of the like squeezy stuff. And that's specifically for the hand and wrist, because when you squeeze like the balls or whatever, yes, you get blood flow, but you're really increasing pressure at that carpal tunnel, and that might actually make it worse. So you don't want to do that kind of stuff. No squeezing. Okay. Because I've also heard a lot of people say that too. They're like, oh, I was going to strengthen, so I got a grip trainer, and they just do this all day. I'm like, that's going to make it so much worse because you're constantly increasing pressure at that tunnel, and that increases irritation at the nerve. Now, if you were to do that motion with no resistance, it's fine. It's actually good. That's why I'm having you do this.
Let's
But
say
when,
you're like
yeah.
gripping something like a dumbbell if you're like at the gym.
Mhm.
Is that bad
It's
or
not, yeah, it's not good because when you're gripping, and they've done studies on this, as you're holding it, the more you squeeze, the more the pressure in here goes up. So if you're doing dumbbell exercises, just grip loosely. Just
okay?
loose grip. Yeah, it's totally fine. I actually think dumbbell curls are great for treating this kind of stuff because if you loose grip it, it doesn't cause a ton of increase in pressure here, but you're actually getting blood flow through the upper part of the arm, which then translates down the arm. So proximal strengthening or strengthening above can really help increase blood flow down below.
Okay, so yeah, okay, that makes sense.
Okay, cool.
And
Yeah,
the pound, the weight of the dumbbell can just be whatever, right? I'm just
yeah.
doing it for the range of motion
Now we're going to
and
talk
the
about philosophy. There's no such thing as weight. Weight is all relative. So what's heavy, what's light is all dependent on who you are, right? What's heavy for me is going to be very different than what's heavy for you. And
Oh, I
so
was talking like 5 pounds. It's
no,
just like
yeah, but that's
nothing.
what I mean is the number doesn't matter. What matters is
Okay.
do you feel resistance and can you do it with perfect form for the number of reps that you want? So for everything that you do right now, if your goal is to increase blood flow, you're working in endurance parameters, you want at least 15 to 20 reps. So that determines your weight. The weight is always the secondary thing. You always want to think, how many am I trying to do with good form? Because however many I'm trying to do with good form determines how much weight I'm going to use.
Yeah.
Yeah.
Yeah, I
So
got
I
you.
think of it, that's what I mean is like there's no such thing as heavy and light. It doesn't matter. All it is okay, what number of reps do I want to do? And then trying to work to failure at that rep range. And that's
Okay.
how you know when you get
While
stronger.
keeping a
Yeah.
loose grip, obviously.
Yeah, loose grip, exactly. So you could do biceps and you
Right.
could also do triceps, that kind of stuff, you know. I
Okay.
think that, yeah, let's try that for now. Don't get too heavy into the strengthening. And the biggest thing is don't do what I call the shotgun effects. So this is something I talked about with Chase Shako too. He was doing 3 hours worth of stuff to improve his stuff. And then I gave him a condensed program that was like 5 to 10 minutes. And he's like, oh, yeah, that's actually better. Because what happens is for a lot of people like you and him, you have these symptoms for so long, you try everything. You start trying this, you try this, but then you're afraid to stop trying the other thing. So then you start adding on all
Yeah.
these things, and it's like you don't actually know what's working. So try to dump all that. Like all the stuff I gave you should take less than 10 minutes, right? Try that first, be very consistent. And then as you add stuff in, you take stuff out, you replace things. So most of the time, most of the programs I develop for people to treat stuff like this, it never ends up being more than 5 exercises because every time you address one thing, now you substitute something else. Now you can pull this thing out. So when you get to the point of doing a lot of strengthening for your back, you don't really need to be stretching your chest as much anymore unless you feel tight because you strengthening your back is directly removing the reason that you need to stretch your chest. Does that make sense?
Yeah.
Like as you strengthen your posture, you don't need to constantly stretch your neck as much. Like all these things are designed to progress your plan. And then now, let's say fast forward a few months or whatever, you're feeling 100%, you're playing as much league as you want, you're working out. You probably don't need to do very much of this at all. Like I actually have nerve pain in my hand that flares up once every, I don't know, few months or so, but it's really minor. And I know what it is. I just need to do some nerve glides for 2 days and it goes away. And
Okay.
that is actually a result of gaming. I played Call of Duty for like 18 hours in a day and I ruined my hand. But so
I've heard that.
I'm
Something
intimately aware
similar.
of this stuff. Like I know exactly how it feels to be like, oh no, like what have I done? The difference is that I know what to do about it, so it's easier for me. But so what I would say is, yeah, try this stuff. Give yourself time. Be patient. You've already spent this much time, right? Just give it the time, the next 2 to 3 weeks. Be patient with it, and
Yeah, I'm patient.
yeah,
I'm patient.
I
Trust me.
think I think it's gonna get really, really. You're gonna have a good outcome. Very short amount of time. Just based on how intense your symptoms seem.
Okay.
Okay,
Yeah.
cool. Any
Yeah.
other questions for me?
Any other question? I guess no. I guess I'll do this. I'll do the stretchings and yeah, I'll talk to you.
Yeah, I want you to reach out
When
to me in the next 2 to 3 weeks. Just give me an update. Just DM me. Let me know how things are going, and then I'll talk a little bit more in detail about the next part of the plan, which is probably how to strengthen.
because honestly, I don't expect like the pain to go away if it's been away if it's been there for this long.
Yeah, I expect it to go away.
Okay, because someone told me, the reason I contacted you, someone told me,
Yeah,
I kind of gave up for 2 months. I
yeah.
just quit. I was like, you know what, f this, I'm gonna just go. But someone
Mm.
told me like athletes they tear up their ACL and they come back within a year. You think you're.
Exactly. I treated
So I was
far
like,
far worse injuries than this, and like, yeah, that's
so I was like,
exactly
damn,
it. Yeah,
that's right. Let me try to
yeah.
do something about it.
You're too young to have this type of thing be lifelong. You know. But it can be. It definitely can be. And this is a thing I talk about pro players all the time. You see pro players who retire because of this stuff. I'm like, this is absolutely not something to retire over. This is something that you treat in a couple of months. You get good. Look at Faker. Faker's not retiring from that. Like
Yeah,
you treat it, you get over it, and you keep going. This is not serious enough. It's not like somebody broke your hand or like you got ran over by a truck or anything. This is
yeah.
something that you just have to adjust the habits that you have and all that. And also, I should ask this at the beginning, but how old are you?
I'm 18 years old.
Okay, you're way too young for this to be a serious problem. You know what I mean? But you also got to think that the workload that you put on yourself when you were 15 is so far beyond what most people are doing at that age. You
Yep.
kind of sped it
But
up. Yeah.
I don't know if that's important, but I have a twin brother,
Mhm.
and he has nothing like no he no hand pain at all. It's just I don't know if
Uh,
we have kind of the
is
same
is he
stuff
is
or
does he play League?
yeah, he's challenger two
Uh,
jungler. He's like a
okay. This
pro.
this this is a whole. Wait, who's your brother? Kryra?
Clara, yeah.
Yeah, in the chat, I see him. Uh, this kind of ties into this. I have this is separate issue, but I think there's a genetic. I do think there's a genetic trait that makes people good at video games because you're not the only one. You like
Yeah.
Sniper, Viper, like all like their whole family is Challenger. What is that? Like, you know,
Yeah.
like I do think that there's a genetic propensity to be good at video games, not just League. And I hate when League players think it's that unique. It's a lot of pro players I've worked with are good at every game they touch. Like they will hit Radiant and Valorant. They'll hit Challenger and League. They'll hit Grandmaster and Hearthstone. Their brain just understands gaming, like how to put information together. Whereas me, I don't think I'm stupid. Like I have a doctorate, but I struggle at League. Like it is just not something that clicks for me. Like it was
Did you
work.
did you grow up? Did you grow up with it?
Oh, I grew up playing games my whole life, but different types of
But
games.
okay.
I think it's the
Because me, like, I
yeah.
was 9 years old. I didn't even know English. I just played the game,
Yeah.
got in some fights,
But this
learned
is
English
yeah.
basically just to be toxic, defend myself.
Yeah, no, but
And I
I
was
think
just
I think that's the thing is that it's the type of games you played, and it's also I don't think I have that genetic component that makes me good at games. I don't think I'm actually good at games. I think I'm good at problem
wait,
solving and I'm good at like logic, but I'm not good at games.
something interesting. I know,
Yeah.
like me and my twin, we're both challenger, right? We have an older brother. He introduced us to League actually, and he was bronze 5, which was like the worst rank, and he's
Yeah.
now
Yeah.
he's just he. So I don't know. He's just
Is he
at the
is
games.
did he
He's a
grind
guy
it?
that just plays. I don't think so. Just plays everything.
Mhm.
Gets like a board, swaps and he's the guy that has like 100 games on Steam, and I'm the guy that just doesn't have Steam installed on
Yeah,
his
yeah,
PC.
yeah, yeah, yeah,
Yeah,
yeah. No, I'm the same way because
just
like
have me.
I'm even worse because I have like 50 games on Steam, but I don't play any of them. I only played League for a long time. Like I would keep
Yeah,
buying games and never play them. But I understand that there is a tendency for certain people to like certain games as well. So for me, what really, really, really got me addicted to League is there's so much information and there's always
yeah.
something to think about. And I have ADHD, and it's one of the few times where I can hyper focus and fixate on like one thing. And it's
No,
really
it actually. keeps your brain active. It's
That's
like
what I mean. Yeah, I
you're
will.
not playing Fortnite, running around the map.
Yeah,
Like,
I
I'm taking shots
never.
off Fortnite. I don't
Yeah,
care, but
I'm never
this game's
playing
bad.
League and in the back of my head thinking about like, oh, I wonder what so and so is doing. Like my whole world is non-existent because I am like on the Rift, like
Yeah, exactly.
so it's few games are made like that, So, but okay, we're kind of diverging. I think what it shows though is that your brother can clearly play. Okay, what does your brother play?
Jungle, everything.
Jungle. Okay, so but does he play any hyper mechanical champs?
Yeah, Graves, Kindred, everything,
Oh,
everything.
I don't know if Graves is hyper mechanical. The same as Yasuo. Like in terms of
Italy.
okay, but
Uh,
in terms of
uh,
APM, I think Yasuo is one of the few.
Yasuo is the most. Yeah, for sure.
Like
And
so
Irelia.
this is actually
No.
something that more nuanced is like I actually have seen differences in players who are one tricks of certain champions because they have issues with this kind of stuff. If you play Zeri, Cassiopeia, Riven, Yasuo, like these champions actually, if you think about playing a year of those champs versus playing a year of anything else, your stress on your arm is significantly higher. It's probably
You
30 to
know,
40% higher.
I want to say that's very accurate because I used to only play Yasuo, right? The first
Yeah.
time I hit Challenger was only with Yasuo, and then as pain kind of started occurring, I think I started playing Syndra, and Syndra, I know it's still you got to move around, but it's not
No,
as much,
it's a mage. So I'm a Swain
Yeah,
one
it's a
trick.
mage, and
This last season, I decided to try to learn ADCs. I was playing Jinx. I was playing Ezreal. My arm was cramping up, and I was like, "Oh my god!" I'm clicking twice as much as I ever normally click because I have to auto, I have to CS, I have to Swain is just like I throw Qs. Like
yeah,
it's
that's right. That's right.
yeah, I wish I could spam Q faster, but they freaking won't like buff his cooldown. So, uh, so okay, I think that's something to keep in mind. Is clearly if you have a twin brother who doesn't have these issues, it must be something related to what you're doing.
Yeah,
So we just change what you're
yeah,
doing,
that's what.
and it
Yeah,
should be
I might
good.
just become a new one trick in the jungle.
All right.
Not even joking, by the way. That's actually
That's actually not a bad idea too. Is when you start playing again, maybe don't start by playing Yasuo. Play some
yeah.
mages. Play something that's less APM and ease back into it.
I got
Um,
to the point where I didn't even like to play Yasuo actually, just because of my hand pain.
yeah, yeah,
I
yeah,
was
yeah.
just like playing Syndra,
I
enjoying
mean,
Syndra.
that's actually what happened to a few high level players, and the reason they switched champions is because they couldn't play their champ anymore, and they decided, okay, I can't spam AP. I mean, whatever happened, I can't play mid lane. Now I'm going to be a support. You play support, and you're like, well, I can play the game. I don't have to click half as often. Like it's not as much laning mechanics like the same way. So yeah, it's something to keep in mind. Maybe this is an opportunity for you also to continue developing your skills in other roles, other champs, that kind of stuff.
Yeah,
Okay.
I'm gonna take it slow though.
Yeah, yeah,
For
yeah.
sure.
All right. I will check in. Let me know in a couple weeks. All right.
Yeah, for sure. Thanks,
You're
thanks
okay.
for talking to me. Honestly,
Yeah,
it
I
means a lot.
appreciate you being willing to do this on stream. I am gonna upload this to YouTube, so I'm gonna edit out some of the filler and stuff, and then we'll try to get
Uh,
video uploaded so it can
yeah.
hopefully help some other people too.
Hopefully that helps people, and
Yeah.
don't wait too long if you have symptoms,
Yeah.
because it's just gonna get terrible, just like me. So
All right. Take care, Aiden.
have a good day.
You too.
Peace.
Bye.